Hi, please allow me to introduce Joni Jones. Joni Jones is a registered nurse who is board certified in mental health and psychiatric nursing. She is a published author, motivational speaker and group facilitator.
I'd like to welcome the participants to part 2 of anger management. I'm going to get into a little bit of those two sides of the brain, the primitive brain versus the evolved brain, and building that bridge so we can get to the emotional side, to the logical side of the brain. So again, if we look at that right side of the brain, and if you're looking at this, it'll be on your left side, this is where we're very impulsive, and we're reacting to what we believe is happening in a situation. The problem with being in this side of the brain is that there's no logic. And if there's no logic, there's no ability to problem solve. But if we look at the left side of the brain, this is where we are non-reactionary. Our responses are based on facts. This is where the brain does understand logic, and we do have the ability to problem solve. So if we're working out of that right side of the brain, we want to build that bridge so we can get over to the side where there is logic and we can problem solve. Neuroplasticity is when we have the ability to change. If we learn something once, we start to rewire the brain, but if we practice it, we get into that hard wiring, and that hard wiring creates choice. The brain develops by the age of 25, but plasticity, or that ability to change, occurs until the day we die. Focusing and mindfulness activates that brain circuitry. So when we have this trigger and we push that pause button and we become very mindful to what is happening, that time gives us choices. And choices, if they're skillfully made, they lead to positive outcomes. We don't have to be swept away by our emotions. We can learn how to be in control so we can respond where we're going to get the end result that we're looking for. There's 7 conditions that put us into the primitive side of the brain: stress, anxiety, sleep deprivation, hunger, health challenges, which includes pain, alcohol, and drugs. And I want to just go into the difference between stress and anxiety. And I'll give an example. If somebody has a fear of bugs and a bug runs across the floor, that's the stress, that's the trigger. The anxiety is the response that we have to that trigger. So somebody can take that bug, remove it, and the trigger's gone, but the anxiety or that response still persists. And if we can think about sleep deprivation, how many of us, if we haven't got enough sleep, it changes our perception, the way that we see things, the way that we feel, and the way that we respond. And I also see this with people who sleep a little bit too long. They're not really getting into that REM sleep or that healthy sleep, and they have different responses because they've overslept. Very interestingly, when I went through my programming and there was that hunger response, I could see it in other people, but until I wrote things down and saw my responses, I didn't see how much I reacted in changing my responses when I didn't have enough food in my system or I was hungry. Health challenges, we see this both physically, if somebody has diabetes and their sugars are going out all over the place, or high blood pressure and somebody's heart rate is up or they have a headache. All those things are going to change the way that we feel and the way that we respond. With the psychological, if we're looking at bipolar and the moods are swinging up and down. But I want to talk about pain for a moment because there's 2 types of pain. There is that physiological pain where if you sprain your ankle and you're experiencing that pain, that's one type of pain. But there's also what's called somatic pain, and somatic pain is real pain. Somatic pain is caused by an underlying anxiety, and it can make physiological pain worse, or it can actually bring on pain that hasn't been in existence before that underlying anxiety. And the difference is how it's treated or managed. And when there's a somatic pain, we want to look at treating it with anti-anxiety therapeutic regimens. And of course, alcohol speaks for itself. Drugs, it doesn't have to just be street drugs. It can be prescribed drugs. Asking the big question, is this going to get me the end result that I'm looking for? Just taking any type of a thinking question builds that bridge to get over to that other side of the brain where we can start problem solving. So again, the primitive brain does not have logical thinking, so we want to get over to that area. And with those things that I just talked about that sets you into that primitive brain, you really only need 2 of the things that I discussed to put you into that side of the brain. But what is okay? Our definition are personal to ourselves. So what is our reasonable, relaxed, balanced state? Mindfulness makes us automatically aware of our environment, okay? Because most of the time, we're not thinking about what we're doing. So if I wanted to get something out of the refrigerator, I might just get up, open up the door, pick something out, go back, sit down, eat or drink it, without even thinking about every step along the way. So when we become mindful, it really makes us aware of that conscious event. And self-awareness allows us to be aware of ourselves. So when we know that we're having that trigger or that change in our mood, again, we can push that pause button, and then we can look at what's happening right here and now and begin to problem solve it. So when we look at mindfulness, it reduces the past and the future to the present. There are so many people that think about what has happened in the past, and they're putting their energy in something that they can't change. And then I have my what if people. So many times people are sitting there thinking about what if. They're reliving that, or they're living it, something that hasn't even occurred yet, but we're having this response in our body, and then that thing never occurs. So we want to go back to the here and now, to be in that moment, to simplify it, and just focus on the task. Again, awareness creates choice. Sometimes we have to teach a skill. And an example of that would be identifying what kind of emotion is going on. In some people, everything comes out as anger, and they don't know that it's really disappointment, or that it's frustration, or maybe they're really sad. So we want to be able to identify what is the emotion that's going on. And then choices forces us out of the primitive brain. But sometimes we have to structure choices. So we can say, hey, do you want to talk now or 15 minutes from now? Versus, do you want to talk? Then we have to look at our triggers. So we can have internal triggers, and that's something that we're thinking about. And this is like what we think is happening. So that's really our belief and not necessarily a fact. We might have an external trigger, and that's some type of behavior. Like if somebody's pointing at me, I might become very reactionary because I believe they're pointing at me for one particular reason, but in reality, they're pointing at me because they're trying to tell me that there's a bee on my shoulder and they don't want me to get stung. And then, of course, there's an external factor, and that might be an event, like when somebody is playing a baseball game and they lose the game. When we get to that anger scale, what I talked about before, that 0 to 10 range, if we score a 5 or above, we're really getting into that adrenaline cortisol response, and we're no longer in control. That primitive brain is now taking over. We're on autopilot. The anger takes over, and many times we say things that we might regret. And any situation can have more than one way of looking at it. For example, if I'm looking at a tank of lobsters, I might see those poor little lobsters with rubber bands around their claws and a lobster that doesn't, and I don't think that's fair. But somebody else could be looking at the same tank and saying, boy, that's a big, juicy lobster. I want to eat that for dinner tonight. When we become aware, and I usually recommend writing things down, and I'll refer to this of an anger log, it allows us to go back and look at what is happening. So if we have an internal trigger, we can say, what thought worked us up? Again, it might have just been our belief. And we didn't push that pause button to really look at what those facts are. Or if we're looking at external triggers, what exactly happened? Why did I respond, that way? And then what was our starting range? So if we're getting out of bed, at a 3 or a 4 level on that 1 to 10 scale, and one little event happens, that can set us over the edge and put us into that primitive side of the brain. So were we sleep deprived? Did we have any type of pain? Were we hungry? What was our stress and our anxiety level just at that starting range in the morning? And then when we look at an anger trigger and we're in that primitive side of the brain, again, we want to build that bridge into the self-awareness so that we can get into that evolved brain and problem solve. So I'll give an example. Road rage. If we're stuck in traffic and somebody cuts us off, if we're aware of the event and say to ourselves, hey, you know what? This is rush hour traffic. It's a heavy traveled route. People are going to cut people off. You know what? I'm not really feeling this. I can get off of this route or, go somewhere and just take a break by getting something to eat so that I'm not responding very impulsively like we do see in that road rage situation. Let's talk about the autonomic nervous system, and we refer to this as the ANS. It's involuntary, and when we're getting that adrenaline response from our adrenal glands, our blood pressure goes up, our heart rate goes up, our body temperature can go up, and even stomach secretions so that we can become nauseous, lose our appetite. There's some people that get jittery, they have tremors, they can get dizzy, they can get weak, and this really goes into panic attacks on some people. So that sympathetic nervous system is that fight or that flight response that I spoke about in part 1. And then we have what's called the parasympathetic nervous system, and we refer to that as the PN. This allows us to calm down or create a balance. It allows us to relax our muscles and normalize our breathing, and it also supports healthy sleep. When we activate that parasympathetic nervous system, it builds the bridge to get over to that side of the brain that we want to problem solve. So we can do diaphragmatic breathing. For some people, they do yoga, and that causes that body relaxation. Meditation or mindfulness. We can breathe and focus on one particular object. We can focus on positive feelings, something that's joyous to us or brings us that serenity. Some people like to focus on sounds and use calming music. There's a lot of evidence base in music therapy. Some people take a cold shower. They memorize a poem or a statement. They can distract by performing a task like taking out the garbage or washing dishes. Some people like to walk a dog or even call a friend. So let's talk about that diaphragmatic breathing for a moment. This stimulates the vagus nerve. And the vagus nerve is in the brain, and it causes that relaxation. I like to bring people back to their childhood when maybe they were blowing bubbles. And I'll say, have you ever felt bad blowing bubbles? And most people say no, they had a good time blowing bubbles. And that's because we're pushing out on that lower abdomen. And when we're pushing out on that lower abdomen, that is when we are stimulating that vagus nerve and producing that calming. And the interesting thing is all those things that I talked about in the autonomic nervous system responses, all of them are involuntary except for the breathing. We can actually control our breathing consciously. We can do what's called Q-controlled relaxation, and this stretches the diaphragm and it relaxes the abdominal tension that's associated with anger. So again, if we push the belly out with each breath, and we can pick a cue word. For an example, I picked a positive word, loving. It can be any 1 to 2 syllable word, and say the word with each exhalation, like loving, and push out on that abdomen. Helping people put things into words helps them decrease their acting out. So if we can get to managing those small irritations without getting angry, may get good results from those difficult situations and help relationships with other people. Saying what you mean improves your chances of getting what you need. And communication in words help people understand you. How can people possibly help you if they don't know what you need? And I see so many people escalate in their anger because they expect somebody to know what they're thinking. But if I asked you if you knew what I was thinking, you'd probably say no, just as I would say no if you asked me if I knew what you were thinking. Many people with unhealthy anger cannot think of rational things to say. And that's why we say a lot of times things that we regret. But if we learn what we need, we can learn to feel okay asking for what we need. So again, we have that reactive side of the brain and that primitive side of the brain. So we really want to get non-reactive and get to that left side. If you expect perfection, or if you demand things to be all your way, is that really being realistic? Except life isn't perfect. Anger shown as aggression or passive aggression often demonstrates a person's urge for control. They want it to be all their way. They demand 100% or nothing. There may be thoughts of should or ought or must, and that can inflame anger into rage. So it's important to look if perfectionism is triggering our anger. Restructure destructive thinking. So an example of destructive thinking, I can't stand it when people get angry with me. It's a very negative emotion. We can make that constructive. Hey, it can be uncomfortable, but I don't really need their approval. I can handle and tolerate disapproval. And that's what we do have control of, that self-talk, that inner voice inside of us. If we're aware of it, then we can change it. Negative self-talk can wear you down and promote poor coping skills. It can also keep you really wound up. But again, changing to positive self-talk helps change the habit. And if you can identify your emotion, for example, if you're disappointed, you know what? I've been disappointed, but I've handled disappointment before and I can handle it again. Instead of I'm with disappointment and I'm going to just spiral out of control being disappointed. If you're sad, you know what? I've been sad before. I've got through it. I can get through it again. And this is how we can learn to become in control of our emotions instead of having our emotions in control of us. Guilt versus shame. Let's talk about the difference. Guilt is when you do something wrong, and shame is when you feel like you are something wrong. Shame is like a sense of failure or defeat. The problem with shame is that it's in our unconscious, and a lot of times we're not even aware of it. It's the most painful emotion. It can lead to despair. It starts when we're infants. We might not even be aware of it. So there's a healthy shame, and that's when maybe we're late for a conference. We walk in, everybody's seated down, but that's only temporary. The unhealthy shame is when it's excessive or distorted, and again, we're not even aware of it most of the time. There's 3 shame anger types. One is I'm not garbage, and we might see people who've had poor role models. Maybe they had parents that were alcoholic, or there might be a person who has a loss of performance, or they have some type of disability where society looks at them a little bit differently, or It could be guilt-induced, and that's when somebody feels that they're not living up to their own standards. It's a lack of their own self-respect. Healing the 5 core shame messages that make you feel worthless, like you feel like you're not good, or you're not good enough, or you're unlovable, or you don't belong, or you shouldn't even exist. See, these things must be addressed because it doesn't go away. And if there is anybody who has ever had suicidal thoughts or have tried to take their own life, there is definitely an underlying shame. And also research will show if there's any type of addiction challenges in an individual, there is an underlying shame that must be addressed. Once we take responsibility, it increases our self-esteem. So we should allow ourselves to feel it. Call it by name. Recognize that you have shame, because if you don't see something as a challenge, why would you even begin to problem solve it? You can then say to yourself, I can handle this, because the real strength is learning to allow the feelings of hurt, disappointment, and vulnerability instead of just flying off the handle. Listen to your body. Feel that adrenaline. Feel the change. Then you can push that pause button. This isn't worth it. I refuse to lose it. I will learn to deal with my frustrations. And you can pick whatever tagline you want. But the practice takes time, and then it gets better. And then recognize that this is a process, because once you practice it, you will change your habit. That positive self-talk is what is shame breaking. I accept my imperfections. I believe in myself. I'm secure and confident. Remember what I talked about. The way you think is the way that you feel, and the way you feel is going to be the way that you respond. I say what I mean and mean what I say. I accept this situation. I can tell you just from learning a basic concept, do I have control of the situation or don't I? And once you recognize you don't have that control and you don't put your energy there, you can watch your stress or your anxiety to that stress go down. And for me, it was major. It was about 80%. There's more self-talk that we can learn in managing shame. Everyone's different. It doesn't make everyone right or wrong. And I do have the ability to stay calm and relaxed. And it's okay to have different needs. And it's also okay to say no. It is also okay for somebody else to say no. I can explore other options. Negative self-talk just agitates. If you're in a place that is not getting you the outcome that you're looking for, think about that inner voice. Is it positive or is it negative? Because if it's negative and it's not working, then that's the thing that needs to change. And again, I can be anxious and get through this. This is certainly not the worst thing that can happen. Either right or sometimes we need to learn effective communication. I see so many problems in relationships because of a lack of that kind of communication. Using I statements to express feelings. For example, feelings are neither right or wrong, and nobody can tell somebody how to feel. But you can either point your finger at somebody and start yelling and saying, you know something, you're making me feel this way. Or you can say, look, I feel very anxious when you're raising your voice. I really want to hear what you have to say, but I need you to just take it down a little bit because, again, I'm feeling very nervous. Or practice saying no. For example, I had to learn how to say no, and somebody taught me. They said no, but thank you for asking. And for whatever reason, I didn't feel guilty when I said no. Tagline now. You need to say no to say yes to what your own needs are. Because when you're saying yes, when you really want to say no, it's helping you short term, but really not long term. So saying no assertively is a necessary life skill, as you can become overwhelmed or be taken advantage of. If a person can learn something, they can learn the education needed to manage. So today is a great day to learn something new. 6 major coping skills. Realize and accept that you are angry. Breathe deep. Don't react impulsively. Visualize or remember your coping statements. Think about the consequence. Is this going to get you the end result that you're looking for? And do something positive with your anger energy. I know I've gotten my whole house cleaned using that energy. Anger is destructive. We can see insults. It's abusive. It's self-sabotaging. But healthy is when we put those words to express our feelings. Your statement makes me angry because, or I feel angry when you. There's 3 ways of dealing with anger. We can stuff it, and that usually leads to escalating, or we can recognize it. We can begin to manage it by developing a plan. We have major anger management tools. Again, thinking about that consequence might just change our behavior. Asking that big question, is the end result going to get me what I'm looking for? If it's not, then I'm going to change something. Having that mindful meditation. And there's something that's called a 3-2-1 process. You can look that up. Ken Wilber is the one that started that process. And again, we can learn abdominal breathing where somebody isn't even aware of that you're doing that. And then there's a tool, it's called Spire. And what this is, it's a little stone, and you put it on your waistband, and there's an app that goes on your phone. And when you're changing your breathing pattern, and you're more breathing from your upper chest instead of your lower abdominal region where calming takes place, it actually vibrates. So you can catch your change in your breathing pattern early by just feeling that vibration, being conscious of it, and you use this over and over and over again, and then you create a new pattern and you don't need the device any longer. People who recognize their consequences, they stop. They build that bridge. I see this in people that may have been involved in a domestic dispute, and they've gone to court, they've got out of that situation, then they're back in the place where they're going to react very impulsively, and they say, you know what? I'm not going to want to go back into that courtroom, and just thinking about that consequence will give them that ability to cross that bridge and now problem solving, find a different way of managing that situation. Consequences can be a great motivator, and sometimes a previous action can promote change. Like if somebody was in jail, they don't want to go back to jail, or if somebody doesn't want to lose their job, or even a loss of a reward or a privilege. When I worked in group homes and there were individuals that wanted to watch a particular TV show, if they knew that they were going to lose that privilege, that changed their behavior. If you've never known about something, you're not going to understand it. And this is when I went back in part 1 and I talked about, when we're infants, we're not born with knowledge, we're born with the ability to think. So if nobody has been shown empathy, then they can't possibly understand it. But once you begin to learn about it, and that's the educational part of it, then you start to use it and it becomes automatic. You're working on that particular skill and you move towards it. It happens naturally. There's no intention. Our coping mechanisms, we have denial, minimizing, and rationalization. And a lot of times I tell people to take it out of their head, because we could be our own worst enemy. And this is when we're really giving somebody else this great advice, but we can't see it for ourselves. Because when we're denying something, or if we're minimizing, we're not making really a big deal about something that possibly could be, or we're rationalizing or making excuses for it, it begins to confuse us. So if we start being consciously aware, writing it down, looking at our emotions, if we can't, answer for ourselves, then, let me tell you, how would it be if it's for somebody else? So many times I'll say to somebody, if this situation was happening to your best friend, what would you tell them? And many times you have your own answer. And again, awareness creates choice. You could either do your plan A or your plan B. Again, let's get back to those conditions of the brain, because you only need 2 of them, enough to be in that primitive side of the brain. So look at it for yourself. What are your health challenges? Are you getting enough sleep? How much sleep do you need? What's your stress level? Is there alcohol in your life? If there is, look at it to go to that moderation. Your anxiety level. Are you hungry? Are you eating throughout the day? Do you need to take, a shake during the day? Something easy, accessible, and drugs. Again, it doesn't have to be street drugs. You can react to prescribed drugs. Everybody has different genetic makeups, and we respond differently. You can take a proactive approach. Develop your plan, manage your stress and anxiety, get the amount of sleep that you need, meet those nutritional requirements, manage that underlying pain and the conditions, monitor the response to medications, take that alcohol in moderation, avoid the illicit drugs. I can tell you, I use a supplementation now that gets down to the free radical damage, the inflammation. I have knocked down a lot of these problems that I had before. So I'm getting the good sleep. I'm managing the pain. I'm no longer hungry. I've been able to cut down on certain medications. And if anybody would like to have more information on that, you can contact me directly. Usually the costs of anger outweigh the benefits. Anger does not provide solutions. I hope that you learned just one thing during this 2-part presentation, because one thing can change your life. If you have any additional questions that I can answer, feel free to contact me.
Thank you for completing this webinar on anger management. You may contact Joni through her website www.the-perfect-balance.net.